So now we're going to talk about the hypothalamic, pituitary, adrenal axis. We already talked about the thyroid axis. So again, it starts in the hypothalamus, hence hypothalamic, CRH, so that's corticotropic releasing hormone. I'm not going to write them all out because they're really long names. That's going to trickle through that little portal system to the anterior pituitary, and then it's going to stimulate cells to release ACTH. So we'll put that there, ACTH. Now this is a tricky one. It's adrenocorticotropic hormone. Adreno refers to obviously the adrenal glands. Cortico specifically refers to the adrenal cortex, right? The outer shell of the adrenal gland. And then tropic, remember a tropic hormone, so TH means tropic hormone. A tropic hormone stimulates the release of another hormone. Okay, so a releasing hormone or a tropic hormone is causing the release of another hormone. And ACTH is going to cause the release of adrenocortical hormones, especially cortisol is what we're going to focus on. Okay, so ACTH, so adrenal gland, cortex, tropic hormone. A tropic hormone causes the release of other hormones. So this is going to go and it's going to stimulate the adrenal cortex. In the adrenal cortex, we're going to focus here on cortisol. So from this pink layer, it's not really pink in real life, it releases cortisol. Okay, and cortisol, and there's some other hormones that are released from there as well. We won't go into all the specifics of those, but those together are referred to as glucocorticoids, and we'll explain here in a second. So let's take a step back. So the adrenal glands are sitting on the superior poles of the kidneys. There's one in each kidney. There's the adrenal cortex, which we're going to focus on. And then just to talk about it, because we need to, the adrenal medulla. So remember, the medulla is the inside of something. So even the kidneys have a renal cortex and a renal medulla. If you think about bone, bone has a cortex, cortical bone. Then you have a medullary cavity or the marrow cavity. So pretty generic terms, okay? So adrenal medulla produces epinephrine and norepinephrine, or what some countries still call adrenaline and noradrenaline. And that's going to be due to sympathetic stimulation when you have a quote-unquote fight or flight response. Now, these adrenocortical hormones, which is what you need to know for the endocrine system, so there's 3 layers of the adrenal cortex. So that's why I made these pretty colors of purple, pink, and blue. The purple is representing the zona glomerulosa. So the zone, or zona, is a layer. Okay, so zona glomerulosa, that produces mineral corticoids. So why mineral? Well, the main hormone here is aldosterone. And what aldosterone does, aldosterone is going to do, well, 3 main things. So let's erase this here, because now we see this is the cortex. So, again, I want to focus on this later when we talk about the renin-angiotensin-aldosterone system. But aldosterone is basically going to cause increased sodium retention, increased water retention, really, because when you increase sodium retention, water is going to follow due to osmolarity purposes, and we're going to decrease potassium. So we talked about the kidney, how you really word this, it increases the reabsorption of sodium and water and increases the secretion of potassium. So you hold on to more water and sodium, it helps maintain our blood volume and affects our blood pressure, and then it causes secretion of potassium, so we're getting rid of more potassium. So we got to talk a lot about that later. Zona fasciculata, which we're going to focus on, right, and that's mineral corticoids, minerals, what's affecting sodium, potassium, minerals, right? So zona fasciculata, the second layer, glucocorticoids. So, and the main hormone there we're going to talk about is cortisol. So cortisol is a stress hormone. So why glucocorticoids? Gluco, we know, refers to glucose, right? Glucose. So when is cortisol released? So cortisol is released in response to stress. So this is a stress hormone. Stress. So what kinds of stress are there? Where there's physiological stresses, right? Like they're physical, right? So physical stress would be fasting. So there's something called the dawn phenomenon. When a patient wakes up in the morning and they're fasted overnight, well, they have a release of cortisol. So cortisol is usually highest in the AM and lowest in the middle of the night at like midnight or 2 a.m. unless you're working third shift, and that changes your cortisol and your stress levels and makes things all crazy, right? So in general, though, someone with a fairly normal schedule, they have the highest cortisol in the AM and lowest in the middle of the night, and different things affect it, like stress. So again, back to the physical types of stress, So that would be like fasting or any kind of exercise or manual labor. So if you're a nurse, you wake up, you skip breakfast, you just have a cup of coffee with no sugar in it or anything. You go to work, you're 5 hours into the shift, you're running around, you're moving patients, you're transferring people. Well, guess what? That's a lot of physical stress. Your cortisol levels will be higher. Now, is that a bad thing? No, it's not. And we'll explain why. So we'll put physical stress. Now, the potentially bad kind of stress is what we refer to as psychological stress. So psychological. Let's move that over. So psychological stress would be stress like I have to pay my bills and I have to pass this test for school and I have all these things going on, right? So we have this huge frontal lobe, other species don't have, so we can think about things and try to make decisions about things and mull things over and get ourselves all worked up, and then our limbic system starts getting all acted up with anxiety, and we can create that whole process, right? So psychological stress can be a really bad thing. So I'll explain what happens. So the main functions of cortisol are two things. One, cortisol is going to increase BG, meaning blood glucose. So it's going to increase blood glucose. And again, when you're fasted in the morning, you get a spike of cortisol. Why do we have that dawn phenomenon? Because we're going to be hypoglycemic. This is going to increase our blood glucose. So when there are times of stress, like physical stress, well, that's fine. You didn't eat breakfast. You're running around using your muscles. Well, you need to release glucose. You need to have a release of glucose and maintain your blood glucose. Now, how does it do this? I don't want to get into too much details. It goes to the liver. The two main processes at the liver, glycogenolysis, so breaking down stored glycogen in the liver, and the other process, especially if glycogen stores are low, gluconeogenesis, right? Glucose, new, and anything genesis is creation. So that's taking non-carbohydrates, especially amino acids, and that'll make sense later when we talk about Cushing's disease and muscle wasting, and it'll convert those amino acids to glucose in the liver. And a big place we can get proteins are from muscle. So in Cushing's disease, when cortisol is super high, we get muscle wasting, but we'll have a separate video on that, okay? So increasing blood glucose, when it's physical stress, that's good. If you didn't have that cortisol, like in a disease called Addison's disease, which is adrenal cortical insufficiency, we become hypoglycemic. That's bad. Now, psychological stress, let's say 4 donuts, I'm sitting at my desk all day teaching, and my cortisol levels are up here because of high levels of psychological stress. Well, guess what? That I'm dumping glucose in my blood when I don't need to, and this can lead over time to fat gain, especially visceral fat gain can be a bad thing there, insulin resistance, and even can be a contributing factor to type 2 diabetes mellitus, okay? The other thing this does is it's immunosuppressive. It's immunosuppressive, and part of the immune system is the inflammatory response. So being immunosuppressive, it's anti-inflammatory. So that's why we derived a whole class of drugs called corticosteroids. They're derived from cortisol, basically. So we use the anti-inflammatory functions. But guess what corticosteroids do? They raise your blood glucose. You can't take them for a long period of time. And if you give corticosteroids to a diabetic, their blood glucose can go really high, right? Even a well-controlled diabetic, you have to monitor them really closely if you give them prednisone, right? Prednisone, methylprednisolone, triamcinolone, hydrocortisone, those are all corticosteroids. Dexamethasone. So cortisol's main two functions are increasing blood glucose by going to the liver, stimulating glycogenolysis, being breaking down glycogen, and then the other process would be gluconeogenesis, creating new glucose out of non-carbohydrate products, which is generally amino acids. So cortisol is not a bad thing. So the biggest thing about hormones, this statement's extremely important. The right amount of hormone at the right amount of time. So if you're hypoglycemic, your blood sugar is dropping, I should say. If you're doing physical work, your muscles need glucose, that's fine. You need cortisol then. When you're fed in a fed state, you don't need high levels of cortisol, right? When you're not doing physical stuff, you don't need high levels of cortisol, okay? Then the last layer, zona reticularis, this produces some sex hormones called androgens, and there's a couple of them. The most predominant one is DHEA, dihydroepiandrosterone.